Good evening. My name's Paul Williams. I am a physician, and what I want to talk about tonight is the immune system and an autoimmune disease, and what I believe is one of the most important things we can do to help ourselves if indeed we have those problems, or to minimize our risk of ever getting them. In order to understand autoimmune problems, we first have to understand a little bit about a normally functioning immune system. The immune system is made up of several different types of cells and substances, and it basically has the job of protecting the body from foreign invaders. Things like bacteria, viruses, parasites, and fungi, as well as other substances like pollen that come to us from the environment. The immune system is extremely complex, and we are certainly nowhere near understanding it completely or knowing everything about how it functions. In normal function, there is a part of the system called the innate system, which basically is talking about the white blood cells that attack things like bacteria to get rid of them. Then there is the acquired part of the immune system, and this is the part that becomes sensitized to foreign substances that show up in the body, and therefore will recognize them in the future when they appear again and be able to deal with them much more quickly. One of the types of cells in the system, one of the major types, are the ones called lymphocytes. There are two basic types of lymphocytes. One is a T cell, that's T as in tango, and there are different types of these T cells as well. One type that is a separate type is called a natural killer cell. And this is a cell that has the job of finding things that shouldn't be there, like bacteria and viruses, and getting rid of them. It also can attack cells that are abnormal, like cancer cells, and get rid of them. So having healthy natural killer cells is a really important thing to do. The type of T cell that is important to what we're talking about tonight is a type called a regulatory T cell. It's also called a suppressor T cell. The other type of the cell and of the lymphocyte involved here is a B cell, B as in Bravo. B cells have the job of producing antibodies when needed, and these antibodies attach to the substance or the structure that shouldn't be there and make it more susceptible to damage and destruction by the other parts of the immune system that come along to do that. And these are the ones that help the system recognize that same substance or structure in the future. Now, antibodies should be produced only when needed. And the regulatory T cells tell the B cells when to produce antibodies. That also means that the regulatory T cells are telling those B cells when not to produce antibodies. We don't need any more right now, so don't make any more right now. Having all of these components of the immune system in balance with each other is a very important aspect of good health. A dysfunctional immune system will have an imbalance. These parts will not be related to each other normally, and the whole thing will be out of balance and not work well. An out of balance immune system with respect to autoimmune diseases is as follows. The regulatory T cells are underactive. I think this is often because of poor basic nutrition, poor foundational nutrition, so that they don't have what they need in order to function as normally as possible. When these regulatory T cells are underactive, that means they're not regulating the level of activity of the B cells. And these B cells now become overactive, producing far too many antibodies when they are not needed. This results in a couple of major problems. One of them is that this means that the immune system is now hypersensitive or hyperreactive. And this is what's involved in all of the allergy problems that many people have. The other part is that there are many of these antibodies being produced that now, since they're being produced when they're not needed, they don't have anything to do, and they begin to attack some part of that person's own body. A normal structure, a normal organ is now being damaged by these antibodies. And this is the first step. This is the initiation of an autoimmune disease. There are at least 60 and probably more in the range of 80 to 100 health problems that are considered to be at least partially autoimmune. Some of the more common ones that you have heard about are lupus, also called systemic erythematosus. I haven't even thought of it in a while. SLE, systemic lupus erythematosus. Abbreviated lupus. Rheumatoid arthritis, ulcerative colitis, Crohn's disease, multiple sclerosis, fibromyalgia, psoriasis, vitiligo, myasthenia gravis, even type 1 diabetes, and many, many more. The attack by these antibodies results in an inflammatory reaction. That inflammation then produces the destruction to that tissue. If it is a disease that seems to affect really primarily one part of the body, like rheumatoid arthritis, certain joints are involved and the lining of the joint becomes inflamed and eventually damaged, and this results in the deformity that is so characteristic of that problem. It's also possible, though, for rheumatoid arthritis to involve the lungs, something a lot of people don't know. In many other diseases, such as lupus, many structures in the body are involved right from the start. Often in lupus, it is the skin and the blood vessels primarily, but many other organs, such as the kidneys, can be involved as well. Many of the treatments for autoimmune problems are aimed at decreasing the level of activity of those overactive B cells. And these drugs can be very effective. And when they do work for someone, it's a tremendous help, decreasing that antibody reaction or damage to the organs, decreasing the degree of symptoms of the disease. However, if you have seen some of the advertisements on TV for many of these drugs, you are aware of the fact that these carry with them a very high risk of very serious side effects. There are many side effects possible, but these go up to and include cancer and death. So really, it would be a good idea not to have to take these drugs, of course. I certainly understand people wanting to when a disease is so severe, but it would really be nice, and I would very much hope for them that we can get them to a point where they don't have to do that. The Whole Food Nutrition program sponsoring our event tonight is called Juice Plus. The foods that we get from plants, fruits, vegetables, whole grains, nuts, berries, beans, etc., contain literally tens of thousands of substances called phytonutrients, also called micronutrients, because each one is there in a very, very tiny amount. And the other part of the concept of this whole food nutrition is that we don't need a large amount of any one of those every day. We need a tiny bit of everything. It is the synergistic effect of having all of these nutrients together that is so powerful for the body. The human body has a tremendous inherent capacity to minimize or control or to even heal sometimes problems that do occur and to prevent what hasn't happened yet, but it must have plenty of this whole food nutrition. Now, I mentioned earlier some of the drugs that are very effective in many problems, but what we're talking about tonight with respect to these autoimmune diseases. I want to make this distinction though. Pharmaceutical products, drugs, as necessary as they are in many instances, and indeed life-saving, are all foreign substances to the body, and the human body's never seen these things before. There's nothing in fruits and vegetables, and therefore in Juice Plus, that the human body has never seen and doesn't know what to do with. The difference is that medications do things to the body. Nutrition does things for the body. In this instance, this whole food nutrition supplies the cells of the immune system with what they must have in order to do what they know how to do to function normally. The research on the impact of the nutrition in Juice Plus on the immune system is as follows. Underactive T cells are brought back up to a normal level of activity. And it appears that this results in those overactive B cells being brought back under control. Now you have a normally balanced immune system again. The different parts of it are going to interact with each other normally. Other studies on Juice Plus have shown a decrease in the systemic or chronic inflammation that is occurring in the body, and these go hand in hand. A dysfunctional immune system and higher levels of inflammation, a normally balanced, normally functioning immune system, and low levels of chronic inflammation. The company has a program called the Children's Health Study, and for 17 years now, any order of Juice Plus allows a child between 4 and college age to get Juice Plus free for up to 4 years in return for occasional questionnaire information about health status for both people. We're over 1 million children around the world now who've gotten free Juice Plus through this program, and the hundreds of thousands of questionnaires that have been analyzed to date indicate that in general these children tend to miss less school, take less medicine, and go to the doctor less often. This also, that many of them, or one of the biggest reasons that this happens is they have a lot less trouble with allergies and asthma, just as we talked about before. Now that the immune system is back under normal control and in a normal balance, it is going to be much less hyperreactive to things like pollen. Anecdotally, in general, in my experience and in the experience of many physicians with whom I have talked, in general, they see in their autoimmune patients, we see a decreased severity of symptoms, a decreased need for medications, and an overall improvement in energy level and general sense of well-being. They also have a significant increase in the resistance to to common infections like colds and flu. A normally functioning immune system is going to do that. A dysfunctional system means you're much more susceptible. Restoring the balance and the protective effect of the immune system means a much higher level of resistance. In my opinion, no one will ever be as healthy as he or she could be if there is not enough whole food nutrition in the diet. Also, there are no health problems, including autoimmune diseases, that cannot be at least helped by better nutrition. If you have more questions or need more information, please talk to the person who invited you to listen to this presentation tonight, and we can certainly help with those questions. My best wishes to you for good health. Thank you for listening.